My name's Kiersten. I'm in Dr. Catledge's Nursing 212, The Evolution of Nursing, and I'm here interviewing Tom Porcelli.
Hi, how you doing?
Good, how are you?
Good.
What is your occupation?
I am a paramedic with Mecklenburg County EMS, also part of the Medical Service Division, which is in charge of training our paramedics and EMTs that we have on staff.
Okay, I'm going to ask you a few questions about nursing and just get your opinion on it.
Okay.
Okay, in one word, describe what nursing is to you.
Dedicated.
Dedicated?
Mm-hmm.
In what ways?
Just about all the time they have to put in, the responsibilities nurses have to deal with. In my opinion, they run the ER right from the beginning, because that's in the emergency aspect of it. So right from the time the patient arrives to when they go to the floor for wherever they're going, the nurses are dedicated to that patient and give them all the care.
Okay. And in what ways does your job interact with nursing specifically?
When we do our transfer of patients, when the 911 call happens, we'll go out and pick up the patient, take them to the hospital of choice. At that point in time, we will get a room assignment in the ER, and then we will have a face-to-face transfer of patient care with a nurse, physically transfer the patient over. At that point in time, we'll still interact with all our treatment that we did in the field and correspond that with the nurses so they can continue their treatment at that point.
Okay. And what do you think should be the minimum requirement of education that nurses should have?
I think a bachelor's degree, if not higher. The way medicine is going today versus years ago, you're going to need a higher degree, because the way we come out of school now is almost like a PA level, like a physician assistant type level. The better education you have, the more advances that you can do in the nursing field, nurse manager, and so forth.
Do you feel that nurses do more job duties than physicians would?
I think they do different duties. Physicians do more of the orders because of the type of things they need to do, and the nurses do the physical aspect of it. They would start the IVs, they would do the EKGs, they would do medicine push. They will take that patient from the ER to CAT scan, ER to wherever they need to be going at that point in time in the hospital. So I think the nurses do a lot more physical, and because I think majority of them work on the orders from the physician, so they can't do anything unless a physician has given an order. So I think they kind of mix into that, but they do a lot more physical than I believe than a physician.
Okay. Well, thank you for your time.
Anytime.